So, how can I help?
Basically, I've had quite bad health problems since the birth of my second child. I've had severe varicose veins down pretty much the majority of my leg, but they were treated.
How were they treated first?
They were pulled out, so phlebectomy.
Okay, yeah.
And I also had pelvic vein embolisation prior to that.
So the varicose veins were extending up and you had some distension up in the...
So basically the scans, internal scans had showed that I had varicose veins in the pelvis, which were leading to the veins in my legs collapsing due to the blood pooling. And they've diagnosed me with pelvic congestion syndrome.
Pelvic congestion syndrome is a condition which affects women where the blood vessels in the pelvis become distended, like varicose veins, and these can cause a lot of pain and a lot of discomfort. We can treat it with a process called embolisation, which essentially blocks off those blood vessels, but unfortunately it isn't guaranteed to work for everybody.
My symptoms have got worse since having this embolisation. The veins in my legs, really came back about 10 times worse.
Whereabouts is the worst pain?
It's just there, sort of.
More so than the leg pains?
I'd say so, yeah, just unbearable.
And what do you do to try and sort of relieve it yourself? Is there anything that helps a little bit?
Putting my feet up. Yeah. It's obviously difficult to children. It's literally the only thing that helps, apart from taking painkillers, but that doesn't take the heavy pressure away as such. Prior to all this, I was really active, walked, cycled.
Yeah.
Now, I feel I'm debilitated most days.
I definitely think we need to have a better look. One of the things that happens with varicose veins as you treat them, stop the blood flowing through one area, it sort of finds another way. It's like when you build a little dam across the stream, it works its way around.
I just feel I've done more damage than good having this embolisation. But
let's get you to a gynaecologist who knows about this sort of thing.
Okay.
How does your husband cope with it?
He struggles though, he's frustrated that I'm obviously getting worse. I think it's more the fact that he can't help me as such. Seeing me in pain, feeling helpless. We've done so much, we've gone to so many appointments.
Is it affecting things between you?
Yeah, we haven't seemed to be getting on very well. There's a lot of stress between us. He's tired, I'm tired. The stress causes us to argue quite a lot. He's got a full-time job, yet he's having to do a lot more around the house and deal with me not being well and moaning and,
But he's dealing with it sort of okay, is he? Or you think he's crumbling a bit?
He's crumbling, yeah. And it escalates into full-blown arguments, and the point that we're going to leave each other. But
you've talked about that?
Yeah, we both know it's down to me not getting better.
You're saying that like it's your fault, though, but...
I know. I do feel like I'm a burden.
Yeah? Why, though? It's nothing you've done, is it?
No. Sorry.
It's okay.
I just feel like I'm not getting better. He's going to refer me to a gynae. He thinks it might be that veins have taken its toll.
Yeah, that's what we thought, wasn't it? But nothing, no revelations. No.
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 So I've been diagnosed with pelvic congestion syndrome. I had the treatment, the vein embolisation.
Theresa?
Yeah.
Would you like to come with me? I'm in treatment room 2.
Okay. I was told by the consultants that this would be the best thing for me. However, it's made my symptoms a lot worse. What I'd like would be for me to find an alternative treatment, to see if there are any other problems that haven't been addressed.
So I'm getting the feeling at this stage you're not a fan of embolisation.
No.
Okay.
I regret having it done.
You regret having it done?
It's made everything worse.
Is it all right if we do examine you?
Yeah.
You okay?
Yeah, it's fine.
Right, so you pop up there.
Yeah.
All right.
But we'll start on the side where you've got no pain.
That's fine, yeah.
What's it like at home?
Yeah, a bit manic at the moment with the young kids.
Okay.
Because I do everything in the night and I get up early in the morning to sort them out, so...
Okay. Then you have to go to work.
Yeah.
You must come back so tired.
Yeah, I do, yeah. Yeah, it is, yeah.
We're always arguing because the stress, the tiredness it puts on both of us. Sometimes I think, he doesn't love me anymore, he doesn't want to be with me. I'm just some invalid that he's got to put up with. He says, oh no, that's not true. But at the same time, he doesn't necessarily show that things are good between us.
Okay, that's fine.
Right.
Okay, I'm going to help you with this.
Okay.
So,
Right.
So, examining you, that you've got a nice soft abdomen, but you have got, as you said, very localised tenderness, highly localised in that one area. But there's no masses, and I can't feel anything else but just the tenderness. Now, you did have a scan with us as well, didn't you?
Yeah.
And we've got that here, and showed normal uterus and ovaries, and no abnormal ovarian cysts, no varicose veins alongside the uterus, or in the muscle of the uterus. So the conclusion is that this is a normal examination. So that's both reassuring, but
Yeah,
obviously,
I know.
in
Just
some
doesn't give me
regards,
answers.
frustrating for you. So the way forward is probably to take a different tack and say, well, is there another cause of pain? Is there something to do with the pelvic? Is it pelvic in origin? I think probably you need a laparoscopy.
Laparoscopy essentially means having a look inside the abdomen with a small camera, and it can be used for diagnostic reasons to see what's going on, to see what the cause of a pain is, or you can even at the time take samples or do a surgical procedure.
Let's hope that gets sorted out sooner rather than later.
Yeah, it'd be nice.
Okay.
What happened?
He thinks I need a laparoscopy to rule out anything else. He could feel the tenderness.
So we don't know any more than we knew already. Isn't it, really? Hey, no better off.
Come along this way. Okay. So, you've seen the gynecologist.
Yeah.
How did it go? What are your thoughts?
He recommends having a laparoscopy
Yeah.
to rule out any other things.
Definitely. We're covering as many bases as we can to try and give you answers.
Okay.
Do you feel a bit happier that things are moving?
Yeah, but I'm not sure if things are moving. I mean, perhaps I thought that I would potentially get some actual treatment, or...
Are you disappointed?
But yeah, a little bit, yeah.
The tests that you've got lined up are the right things to be doing. I think the most important thing we can do is keep going for your sake.
Yeah, just take weeks and get some answers. It's difficult, isn't it? I mean, it's ruining our marriage, just being like this.
Right, what do you feel?
Yeah, it'd just be nice just to have my wife happy again, because that affects the whole family.
Yeah.
And it affects the whole family every day.
Yes, you can say it all comes down to me, which probably does, because, I should be doing more. And I think perhaps you have some resentment that you're having to do more. And, I think you feel that, I'm always ill when I had the sickness bug. You told me to get out of bed and get on with it, and it wasn't easy.
No, but sometimes you have to rouse yourself, don't you? I know it's difficult.
Yeah, but I couldn't that time.
Sometimes my job is to try and mend relationships as well as heal. I've seen relationships completely fall apart due to an underlying medical condition in one person. A happy patient, a confident patient is going to face an illness far better than a patient who isn't.
Sometimes, I don't think it all is just down to my problems. There's fundamental things in our relationship we need to sort out, which, regardless if I'm ill or...
Do you think you guys could benefit from a little bit of help in that area?
It was in counselling.
Whatever. I think it would help, I really do, to thrash it out. I don't mean literally, but, talk things through, lay it out. You say what you're not happy with, you say what you're not happy with. but also importantly, say what you are happy with. Actually, acknowledging what is nice and what is good is important, because you get so clouded with the bad stuff, you know? But if you need, you know, a little bit of help to do that, it's no bad thing, it's no weakness, you know?
Yeah, well, it's worth thinking about.
Yeah.
Yeah.
I would love you to stay together and help each other through this. It's not all doom and gloom forevermore. There are ends in sight. You know, there are possible options we can go down, and I'd like you to go down them together.
Yeah.
Okay? All right. Thank you so much for coming. I appreciate it. Come on out. If you go back down to reception, they will look after you there. All right.
I'm feeling, you know, slightly optimistic that, you know, the investigative treatments could possibly help me.
Please both sign up for me.
Yeah.
Just over here.
I don't think there's really much more that my husband can do. He does as much as he can. Maybe I shouldn't be so needy, but the way I'm feeling, you know, I need that emotional support. Yeah.